So let's switch topics and now talk about the endoscopic sleeve procedure, also known as non-surgical sleeve. The endoscopic sleeve consists of reshaping the stomach in such a way of the regular surgical gastric sleeve. But this time the procedure is performed totally through the mouth. So there's no cutting, there's no pain, there's no incisions or scars. It's a newer procedure. It has about 3 years of history and the patients are very, very successful. We perform the endoscopic sleeve gastroplasty by visualizing inside of the stomach and placing specific sutures that will give the patient restriction, primarily on the portion. It will also change the patient's response to hunger. So let me show you a quick introductory video about how the procedure is performed. So the endoscopic sleeve procedure is a non-invasive procedure performed through the mouth. We advanced a special camera into the stomach, designed primarily to achieve weight loss. We place special markings on the areas of the stomach that we want to target to achieve reduction of the portion. After we have placed the markings in the stomach, we proceed to place sutures with the scope inside of the stomach. These sutures are meant to be permanent, but as any sutures, they can break. So this procedure could be permanent or temporary because it includes sutures. So if we cut the sutures, the procedure could be undone. We continue placing all those sutures from the bottom part of the stomach towards the top until we achieve a reduction that is sometimes close to 60 to 70% of the total capacity of the stomach. It also helps the patient feel full quicker and for a longer period of time. As you can see in the video, it's a minimally invasive procedure. It requires no cut, it is non-surgical, and is performed in an ambulatory setting. That means you get to go home the same day. Most patients wake up from this procedure with almost no pain. They get to go home the same day, and they adhere to a liquid diet for the next 2 weeks until we give enough time to the stomach to heal. After that, we advance the diet and we follow almost the same progression as a regular surgery, with the difference that this is non-surgical procedure. We have patients that go back to work within a day or two, depending on how the feelings of the symptoms. Most patients may experience some nausea or no symptoms at all. So after your procedure, you followed in the office for a period of 2 weeks, 1 to 2 weeks after, a month, 6 weeks, 3 months, and we continue that close surveillance of the patient for the weight and nutritional program to make sure that the patients are progressing in the way that they should. With the information available today, it is a very safe procedure. As such, the risk of any problems or complications are very little. Theoretically, you could experience some bleeding or any perforation on the stomach. However, this is extremely unlikely. The disadvantage of the endoscopic sleeve gastroplasty is that as of today, it does not have insurance coverage. That means it's a private or self-pay procedure. The cost of this procedure ranges anywhere between $8,000 and $15,000. Luckily, we have one of the most affordable programs in the nation.